My research broadly will show that how the lack of access to the high quality maternal health care resulted poor maternal health outcome among marginalized women in Bangladesh. So specifically, this research will show that not only the contact of care or the access to care is important, but also the content of care is very, very important. And in that, I considered Bangladesh as a case example where the women had contact to care or access to care, but the quality of the care was not satisfactory or not good. And that resulted women to do more harm than good. If you look at the global development agendas or global health goals, you will see that the Millennium Development Goals or the Sustainable Development Goals, which are more known to in public health literature and public health programs, their emphasis is always on the contact of care. That it is necessary to increase the contact of care. However, in such goals, the quality of care was neglected. First thing, Bangladesh was one of the lower middle income countries, which was at the forefront to embrace those global development agendas or goals in their maternal health care policies. But the country like Bangladesh, where it is very densely populated and there is resource constraint, the public healthcare facilities couldn't do that properly. Like there was various inefficiency, inadequacy exists in the public healthcare system. So the rapid expansion of the private healthcare facilities happened in Bangladesh since the 1990s. And when that happened, there was not adequate quality control. In the private healthcare system, there was a lot of increase of the private healthcare clinics. However, there was not accountability, there was not supervision in those systems, the private one. And as a result, it created a diverse quality of healthcare facilities or healthcare system within the private healthcare system. It happened in a way that people who are rich and who have enough money, education, and information, they are able to access high quality care. But the poor who do not have education or money or the access to resources or information, they ended up to avail the poor quality of care. So the private healthcare expansion actually created a hierarchy among rich and poor. And poor people, they, for their severe illnesses or when they need, they go to the private healthcare facilities. Sometimes they go to the public healthcare facilities. But the public healthcare facilities created an impression among them, especially for women who always face gender discrimination and various disadvantages, that it is too difficult to get care from there in public healthcare facilities. So their only option is to go to the private healthcare facilities, and then they go, but they can't go to the high quality private healthcare clinics. So they go to the lower quality or poor quality private healthcare clinics, where often there exist the providers do not have adequate skills or training. The facilities, other qualities are very poor, and that ends up in a situation that women may have surgeries with error, over medicalization, wrong treatment, and that creates harm to women. When actually I started to do my fieldwork in Bangladesh, I didn't have any intention to investigate on the quality of healthcare. I went to interview the women with genital fistula. But later, I found that when I talked with the women, I found that they are facing so much challenges to access quality healthcare, and um, that is because they don't have money. They are women. They don't have information, and the healthcare system created a hierarchy where poor can get only poor quality of care. So that derived me to investigate why women's situation is like this, why they don't have access to quality healthcare. That led me to investigate more in the context of healthcare system, because the healthcare system has been creating this problem. My research will calls for the necessity to redesign or restructure the healthcare system where everyone can have access to the quality healthcare. Not, it will not be dependent on gender, it will not be dependent on the social economic classes, but the slogan that is health for all, or the health is a right, to achieve those, it is necessary to know what is going on. And this inequality existing within the healthcare system, which is causing various problems or various difficulties for the women, firstly to access quality healthcare, and then their health and well-being both. So my research will show that it is necessary to change the healthcare system in a way where poor people can have access to public healthcare facilities, which is free of cost now, but there exists hidden cost. If women go to the public healthcare facilities, they face the absenteeism of the doctors or providers. The doctors or providers are not available, or they have long wait times, which is difficult for them to accommodate. And they face various harassment, disrespect, and abuse in the healthcare system. So those need to be changed. And then if I think about private healthcare facilities in the context of Bangladesh, that has those diverse quality, and that is causing harm for the women, that also need to be changed. That private healthcare facilities, firstly, they need to be accountable. They need to be more, it requires more supervision and monitoring in the private healthcare system, so that they can't provide poor quality healthcare system who are doing those, like not all the private health facilities are doing those, but who are involved in such malpractice, they should bring under law or supervision, so that like it is like the money what women are spending in private healthcare facilities, they get the benefit of it. My research is partnered with United Nations Population Fund, which has been working on women's health for decades in Bangladesh. Some of them will be probably co-authored with me when I will submit this paper for a journal. And I have planned to do some seminar or information session about my findings from this research as well. Here, the two parallel healthcare system, one is better care and another is poor quality care. Those are not something desired, and that has been causing various adverse maternal health outcome on women. For example, like in my research, it was shown that women who went to the private healthcare facilities, of course, those are like those poor quality healthcare, private healthcare facilities who went, they had to do like some unnecessary hysterectomy surgery. Didn't know that what was the reason for doing that, and there was not proper diagnosis sometime, or um, they had like heavy vaginal bleeding, and they went to a doctor, and doctor even didn't do a test, and they said that you have to do surgery, um, and you have to remove your uterus. So, and then when they did the surgery, because they didn't have any other option to do, so what happened was like they did the hysterectomy surgery that created like fistula among them. Okay, so fistula means like a hole created in their rectum or uterus, and that caused like continuous leakage of urine or stool or both. Is those type of outcome is not desired, and it is basically like what I referred to, doing more harm than good for those women when they went to access healthcare. And also, like in my research, I also found that women who had like probably a little bit of money, they went to check with the doctor when they were pregnant. Some private healthcare providers sort of led them to have cesarean section, they even if they didn't need it. And the healthcare system is in Bangladesh is came to in a situation where although women don't need, they will do scheduled cesarean section. The providers do not have time, or due to the lack of emergency obstetric care, the women have to do cesarean section. They don't have other choice, or sometimes they are forced. So uh, I this type of thing actually um, um, has not reported in the context of Bangladesh yet. Always the research was like in the context of patients' perspective, that why patients decided that, how health system is impacting this, like from the other side, there is not research on this area. So I feel that the behavior of the women or the health outcome of women or any individual is not only influenced by their own decision, but it is much more influenced by the or shaped by the environment they are, or by the healthcare system. The research will show that it is necessary to create an equal healthcare system for all women, where they can avail the high quality healthcare. Many other low and middle income countries like Bangladesh, their health policy is highly influenced or designed by the global development agendas. So here I want to emphasize that the global development agendas such as Millennium Development Goals and Sustainable Development Goals, those from the beginning emphasized on the contact of care, like the women just access to care is important, but they didn't emphasize on the quality or the content of care. Maybe like in Bangladesh, it came in a way through the private market, but there is other impact. And for other countries as well, there is similar impact. I can tell that in South Asian countries like in India, the private healthcare market also is expanding, and unnecessary medicalization or the over medicalization is also an issue there. And so in other low and middle income countries as well, the quality of healthcare or the quality of maternal care is not getting importance. And specifically how the health outcome of women is, I can tell that the situation that is existing in Bangladesh, for example, the provider's error, the inequality among rich and poor, those are common in many countries, in lower and middle income countries. So it is applicable for other countries as well.